Hi, my name's Helen Ashton and I'm one of the research ANPs at Great Ormond Street Hospital. When I started this role, there was only one paediatric research ANP in the UK, Lucy Cooper at Birmingham NIHR CRF, so I quickly got in touch with her for some support. This was in 2017, and even now there are only 3 paediatric and 3 adult research ANPs plus 1 trainee working at GOSH. In 2018, we created a national forum for advanced practitioners in clinical research in the UK to provide peer support as well as to help develop the role on a national level. So I'm going to talk to you today about my role at GOSH, as well as the other ANP roles that we have. So to look at the different ANP roles in research at Great Ormond Street, how these came about and the differing ways these roles have been funded. Until recently, we had quite a flat structure. Opportunities were limited once you reached the Band 7 CRN role. In 2017, we found we had an increasingly complex early phase portfolio that needed a different skill set in order for us to deliver the portfolio safety. The opportunity for growth and innovation within the service was reflected upon, and Lorraine Hodgson, our head of nursing, had recently spent a fair amount of time over the previous few years with US colleagues and was impressed with how they had integrated the ANP role within clinical research. So my trainee ANP role was created. At GOSH, we now have 2 qualified ANPs and 1 trainee ANP in research. These posts are Band 7 whilst training and then Band 8 on completion. My role is focused on early phase high intensity trials. Karen Howe works on the oncology portfolio, and Katie Groves is currently doing her ANP training and works on the neuromuscular portfolio. We've used a variety of funding models to secure the posts. For my role, utilising CPD Director allocation to top up an existing MSc award, and more recently, accessing the funding to undertake the training element of the position through Health Education England's apprenticeship pathway, a route which provides 40% ring-fenced time alongside funding for the training element of the role. In addition, we have utilised a number of different approaches to establish the posts and ensure sustainability. These include building the positions into the core Research and Innovation Directorate infrastructure, as well as utilising a mix of charity post funding and commercial research income to fund the positions. Sustainability of the posts has been an ongoing discussion, and aside from what I've already mentioned, we're exploring phased infrastructure funding models, as well as working with the PI and study sponsors to build the cost of the research ANP into the trial budget at the outset. A model that is a work in progress, but certainly received initial positive responses. So just to tell you a little bit about my background and training and my path into research. So I was an oncology staff nurse from newly qualified and worked up to CNS within this area and have around 14 years experience. And that's where my interest in research began. I moved to Great Ormond Street Hospital in 2015 as a research nurse and was recruited into the trainee post in 2017, just after completing my first master's. I then immediately began my ANP programme at LSBU. I completed this in May 2019, just in time to take a year's maternity leave. So I've been back in this post for 1 year. I feel like it's going really well and have achieved a reasonable amount so far, particularly when you consider the current situation. I'm on logs as a sub-investigator and have been since May 2020. I carry out physical exams as well as dosing, and I aim this year to extend the number of studies I work on, and also I'm hoping to open my first study as PI this year. So like all ANPs, we job plan using the 4 pillars approach, but our levels of activity may be quite different. For example, our research activity will most likely be a lot higher than a general PEDS ANP. And we also find that it's variable day to day, week to week, and month to month, depending on what studies are open, what stage they are at, as well as other priorities and the general nature of our work. So thinking about our day-to-day work, this is how we achieve our clinical pillar. So I'm delegated on trial logs to be a sub-investigator in the same way as the research fellows that I work with. This role is to support the principal investigators with the clinical delivery of the trials. We work as autonomous practitioners providing medical cover on the CRF for research participants. We can assess, diagnose, treat and refer patients, often taking complex medical histories and carrying out physical examinations of patients. We can assess eligibility of patients for trials and take consent for non-CTIMP studies. I have trained in some advanced clinical skills, for example, intrathecal drug administration via implanted devices. I also carry out non-medical prescribing and radiological requesting. We also provide provision for continuity of care and help with the transition of new drugs into the clinical service. So in terms of our management and leadership pillars, we all have many differing examples. Day to day, we provide leadership to both the clinical and non-clinical teams in which we work, and this can help support professional development as well as provide peer support. We work on SOPs, guidelines, policy, working practice document development. As I mentioned previously, we formed a research ANP forum with the other research ANPs around the country. We assist with setting the direction and vision for the CRF in which we work. We try to lead the way for ANPs in research and provide education about our role, doing presentations such as this, as well as publications and other conferences. We're working towards trying to develop a new career pathway for paediatric research, and I really enjoy talking to new research nurses and seeing the enthusiasm when they learn about the possible career pathway that they could have. We're also members of other national forums and strategic groups. So a big thing is that we've all faced challenges in these research ANP roles, and these have been common across all research ANPs in the UK. We need people to understand and accept our role. And for this, as I previously mentioned, we're trying to educate people about our role. We need to show people that the role is beneficial for them. So we show the PIs how it helps them carry out research, etc., with reducing the burden of research on them. We need to work within the confinements of regulatory bodies. As the quote there shows, the MHRA in GCP is quite subjective. It talks about a qualified physician. Does that include an ANP? And we've seen variation from sponsors as to what they are happy for ANPs to do. So maintaining our own professional development and skills. There is no specific training for research ANPs or competencies to achieve. We've just fitted around other people's and other roles. And there's a large variety of specialities included. So the high intensity trials that I work on could come from any speciality across the hospital. And finally, demonstrating our success and value for money. It's quite difficult to show how the role works. It's quite subjective, but we could look at patient experience, continuity of care, reduced waiting times, as well as support from junior members of the team. So future aspirations of our role. Personally, I want to develop my role and as many skills as I can to work at the highest level I can do, potentially in the future being the PI for CTIMP studies. I hope we can see more research ANPs across the UK and that we can help develop a career structure for other research nurses. Alongside this, we're working for greater national recognition of the role, as well as greater acceptance. If you have any questions, I'll be happy for you to get in touch and we can talk to you about them. So I'd just like to acknowledge Lorraine Hodgson, the Head of Nursing at Research and Innovation, who's driven the development of these roles, as well as Lucy Cooper and the other members of the National Forum for Advanced Practitioners in Clinical Research. Thanks.